Hi, I'm Liz O'Riordan. I was a consultant breast surgeon who got diagnosed with breast cancer in 2015 and had a local recurrence in 2018. And I went from being the girl who did no sport at school to the woman who did a sprint triathlon halfway through chemotherapy. There is so much evidence now to show that exercise should be the fourth treatment of anybody with cancer. It can reduce the side effects of treatments, chemotherapy, surgery, radiotherapy. It's the one thing that can help fatigue, although it's the last thing you want to do. It can help with mindfulness, with the mental side effects, anxiety, depression. It can also reduce the risk of recurrence by up to 50% in breast cancer patients. It gets people out of hospital quicker after surgery. It really is the miracle drug, and it's free. Everybody should be doing 3 sessions of aerobic exercise where you get your heart rate up and you're sweaty. But most importantly, it's 2 resistance sessions a week. The 2 have to go together. I only got into exercise in my late 30s when I met my husband, who started cycling. And I thought, if I don't cycle, I'll never see him. And that led to us doing a 100-mile bike ride. And that led to me getting bored and looking into triathlons. I used to do a bit of swimming and running at school, but I did nothing regularly. And I just signed up to do a triathlon before my 40th birthday. And I was diagnosed with breast cancer a few months afterwards. And sport was really important to me, but no one told me whether I should exercise, how to carry on training. It wasn't mentioned. I couldn't believe when I was diagnosed that I might not be able to exercise for the next 5-6 months during chemo. It had become a really important part of my life. And I didn't know what to do, what was safe. Everyone says ask your doctor if it's safe to exercise, but I'm a doctor, I've had no training. So I turned to Twitter and I found some amazing athletes who were still cycling and rowing and kayaking and training, some of them with metastatic cancer. And I thought, sod it, I'm just going to do my own thing. Plus, I was told by a friend, the best thing I could do to help the symptoms of chemo was to exercise every day. And it worked. So I started walking every day with a neighbor. I started doing park runs, bold as a coot with everyone staring, but I didn't care. I even did a pool-based sprint triathlon halfway through chemo. So chemo for me was 4 or 5 days of feeling like absolute hell, and then I'd get an okay week and a great week. And although I walked every day, I wanted to see if I could carry on running and cycling and swimming during chemo. I had my chemo in the summer, so I would cycle to my chemo sessions and my husband would drive me back. And it was so good just to bomb along the country lanes with the wind in my hair. Well, not in my hair because I was bald, but just feeling free. And I swam at the local health club because I had a tunneled line, so it was safe. And I just thought, I wonder if I could do a triathlon, because I was meant to be doing a half Ironman in September. And obviously I couldn't with chemo, but my local club was doing a sprint tri, a pool-based one. And I begged them to let me do it. And I had to promise I'd be sensible and that I wouldn't need a doctor and I wouldn't race. And because the slowest people went off first, I wasn't last. But it took me 2.5 hours. But that feeling of cancer hasn't taken everything from me. When I crossed that finish line, I was just Liz. My husband and I were crying, and it meant so much to be able to carry on with some part of my life and hopefully inspire other people to say, you can do it. I think it's really hard as a patient hearing that you have to exercise, because a lot of the treatments we give women with breast cancer make them put on weight, make them go into the menopause. And you think, sod it, I've had cancer, now you're telling me I need to go and run. And exercise can sound like a dirty word, but it is so important. It is something you can take control of. It can be as simple as walking every day. So your heart rate's up, you can listen to a podcast or an audiobook, just seeing how far you can walk every day. The Couch to 5K app is a great way of getting into running if that's something that appeals. Often most breast cancer centres will have information about moving on groups, and often the local councils will do programmes, swimming for ladies who want to swim, various fitness classes that are reduced. It doesn't have to be running, it could be any sport that you like. It could be rowing, it could be climbing rocks. It's just finding something you like that's enjoyable. But the thing that will help women doing it is having that sense of community. And that's why I love park runs, the 5K Your Way, where you're doing it with other people and you have to turn up because they are. You just have to make it part of your life and ideally bring your family on board. So when I was just coming at the end of treatment, I was trying to find other people who are exercising just to inspire me and think, oh, they're doing that, I could try. And we realized there's nothing out there. There's nothing for the elite athletes who want to carry on doing Ironmans. There's nothing for the man in his truck with prostate cancer. So what I've done is create a charity with 4 other people, about to go live in a couple of weeks, with a website of patient stories, people with cancer, metastatic cancer of all ages, who are exercising, and they've put in blogs so you can read and get inspired. We're also putting in all the evidence showing what you need to do and why you should do it. Also to educate doctors and nurses so they know how important it is to keep telling everybody to exercise. It's now 2 years since I had my local recurrence, and new guidelines came out telling you again the importance of aerobic exercise and resistance training. And I realized I wasn't doing any resistance training, and I can't be a spokesperson for exercise and cancer if I'm not lifting weights myself. So I started going to the gym, and I love it. I'm only in there 45-50 minutes a time. I'm lifting weights really heavy. I'm getting really strong. There are muscles on muscles I've never seen. My shoulder strength has improved hugely. And it's also, not only is it reducing my risk of recurrence, it's improving my bone strength, it's reducing the risk of lymphedema, and I just feel so fit. I may enter a bodybuilding competition next year. I'm going to see where it takes me, but at the moment, I'm just loving getting strong. I think weight training is even more important than the aerobic training. Not only to improve your bone strength, reduce the risk of osteoporosis, but also to help, especially older in life. One of the biggest reasons people go into nursing homes is that they cannot stand up from a chair. People with metastatic cancer will stay in their homes longer if they can walk upstairs and get themselves off the toilet. It's just basic looking after your body. You won't get big if you go in the gym and lift heavy weights. It takes years and years and steroids to do that. And it can be at home. It could be doing lunges, calf raises, using tin cans, doing press-ups against the kitchen counter to get you going. There are lots of exercise videos on YouTube that you could do. The great thing about the Endomag 100 challenge is it's encouraging everyone to exercise, not just breast cancer patients. It's not go and eat cake and give money, it's being healthy. And if we can get doctors and the team Endomag exercising, they will encourage their friends, and then hopefully patients will be encouraged to do it. Because exercise can reduce your risk of getting cancer in the first place, as well as reducing the risk of recurrence when you have it. It really needs to be the 4th treatment that everybody is talking about it. And the fact that the money is going to research to help prevent breast cancer and maybe other cancers in the future can only be a good thing.